This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetrimax Veterinary Supply. Vetrimax makes it better. Hi everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King, the doctor's sister. I am not certified or board, whatever, in anything. I'm a pet lover and owner, and we're here to bring you some really good science-based information so you can be pet owners. Pretty much it's all the stupid questions I call my sister at 2 a.m. to ask her about, my pets. So we're bringing it all to you. So if you have questions, email them to us. But we always have some phenomenal guests. So who do we have today? And it's a
encore visit.
Yay!
With Dr. Karl Jandrey. He's the professor of clinical small animal emergency medicine and critical care at UC Davis. Dr. Jandrey is a Buckeye, graduated from Ohio State University College of Veterinary Medicine. Yay!
National champions, just reminding you all.
Oh, fabulous. Did an emergency internship in LA and his residency in Northern California. Went east to Philly, where he was director of emergency services at a specialty hospital. Came back to UC Davis in 1999, where he is now the associate dean of admissions and student programs. Dr. Jandrey's the person to talk to, at least at UC Davis. He currently teaches patient side in the emergency room and intensive care unit at the Pritchard Veterinary Medical Teaching Hospital at UC Davis. He shares his life with another veterinarian clinician scientist, a perfect yellow lab, which we always have questions about that, numerous saltwater tanks, and 2 recently adopted cats. So we have Dr. Jandrey on today because I don't want you all to feel helpless when you come upon an injured animal, an emergency situation. We're going to ask Dr. Jandrey, what are some tips that we need to follow? God forbid we see an animal hit by a car or want to rescue an animal. So,
and it happens. It happens when you're least expecting it, when you're visiting your sister in Ohio. And she says, come on, and throws a trap in the back of the car and a couple of shovels and said, I was out on my walk and there's some baby raccoons stuck in a
hugging
thing,
each other in the
hugging
street.
each other. And I'm like, sucker, okay, this will be easy. Like they're going to be little kittens. And those dang things, when you go to shovel them, they're like, ah!
I know.
So I jumped about 100 feet.
They do like to make a lot of noise. But having said that, how horrible would you felt by not helping them? And I'm talking helping things like turtles, because, you know, spring will come to Ohio, Janet, where I live, and in Connecticut where you live, and we got those turtles are crossing the road, and
you taught me, you move it to the direction it's going, but you the sides of don't go near the mouth.
And don't pick it up by the tail.
No. And they tend to retract, but then they'll come back out. So no,
except snapping turtles. Snapping turtles aren't big on retracting. They can really reach that head around.
Hence
so
the name snapping. Yeah.
But since Dr. Jandrey is all things emergency, we've got a lot of questions for him today because, you know, sometimes what's deemed an emergency to a vet really isn't that much of an emergency, but then things that the pet should have been seen for as an emergency aren't recognized by the owner. So we need to kind of weed through that today with Dr.
And
Jandrey.
this might help avoid those 2 a.m. phone calls from the sister. Yeah.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator-based called NP, or a hydrolyzed salmon-based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets. Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. AtopiCream HC by Vetrimax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. AtopiCream HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetrimax products. Vetrimax makes it better. Welcome for his encore visit, Dr. Karl Jandrey. Janet, why don't you start? Because we have a ton of questions, Dr. Jandrey.
So I'm going to start with what is the number one dog emergency or cat emergency? What that you see in your practice?
Great question.
That the pet owners should be. I'm sure it's a collective, but that owners should be aware of.
Well, that's like a loaded question.
Or prevent. Like I know, like swallowing the sock, the corn cob.
got it.
I'm making it.
I mean, there's a huge array of veterinary emergency practices. Some people have access to a general practice that's open late into the evening, whereas some might be more in an urban center where it's a 24-hour specialty hospital, or if they're lucky enough to be near a 24-hour academic teaching institution. There's about 34 of them in the country right now. They all have different accessible points, and the types of patients that are seen at those local places are very different. So if I'm going to answer your question very cleanly, it's a tough question, but everyone that I see might not be representing the normal local practice, because we see the sickest of the sick from almost the western half of the states. Like, we see so many things because of the advanced types of care we can give. We see a huge number of very severe, very complicated patient referrals. But don't get me wrong, we see plenty of first opinion cases as well. We see almost just over 10,000 patients a year through our emergency room. So when you talk about what's common, really what's common in private practice are things like cat bite abscesses, urinary obstructions in cats, dogs who eat things they're not supposed to, whether they're foreign material or they're meds from the owners in their household or strange products out in their garden or on their farm, versus some of the other types of things that we might see because we have specialty services. We see a lot of advanced care for things like hemodialysis and hemoperfusion for toxins or for renal replacement therapy. We see a lot of animals with acute spinal injuries that are mostly due to discs that are weak and they break and impinge the cord to cause paresis or paralysis in these dogs. So we see a mixed bag. I think your question is probably leading towards what should people do, or what should they be ready for, or what should they have at their back pocket as they get to the veterinarian. Let's just say the common things are common across the world. And let's just talk about vomiting and diarrhea for a second.
I love those two.
I mean, it's hard to have.
Wait a minute.
For me,
That's always an emergency because it affects the household.
Yeah, you certainly don't
Yes.
want diarrhea all over your nice white carpets. You don't want.
No, Alice sent me. It's a yellow sign like they use that says wet floor, and it says caution, cat vomit, and on one side it says vomito de gato, and it has a cat going. You sent that to me years ago, so when we have an incidence of it, we pull it out.
Carl.
Yeah. So
I'll go
I would
get
love
it.
it.
It's hysterical.
I would totally love it. I would suggest that, not every animal that vomits needs to see the veterinarian or doesn't need to come to the emergency room. So let's talk about the thresholds over which you should seek veterinary care. How's that? So if I'm a healthy, middle-aged dog or cat and I never vomit and I never have diarrhea, I'm eating, I'm happy, I do all the things, whether I'm indoor, outdoor, whether I have an active hunting lifestyle or I'm a couch potato, let's just set the stage. I'm not a vomiter. Okay. One time vomiting, you kind of look at it, you're like, that's weird because that's not what my dog or my cat typically do. But if they're still wagging their tail, they're still interactive, they're still eating and drinking, you might just watch and wait. However, if this is an animal who never vomits or never has diarrhea, you're basically like, at what point do I go to the veterinarian? One is too much, too much. If it's a healthy, otherwise young animal, if they stop eating, they look more lethargic. They aren't doing their normal interactive behavioral patterns like they normally do. And you say, something's off. Like your brain is like, I don't know what's wrong, but something is just off. Perfect. Maybe then you should seek the attention. That's for the healthy middle-agers who never really vomit. Let's talk about the extremes of age, the youngsters and the oldsters. I don't wait as long on those guys because there could be something more insidious. Age is not a disease, but more things happen more commonly as we age. And there are more things that are more likely in youngsters too, especially things like infectious diseases, whether they're parasites or viruses. So I would say my threshold for seeing veterinary care is shorter than if I was a healthy young middle-aged kind of adult cat or dog. So if I'm going to wait 3 days, for instance, on a dog or cat who's middle-aged, I might wait a day, day and a half on a small youngster or an oldster. Okay, those are the healthy ones that never do all the weird things. Let's talk about the ones who are always vomiting.
Ooh,
You have them. There's a cat, there's a dog. I vomit once a week. I vomit every other day. I vomit a hairball. I go on my happy way. Like, that's a normal pattern. So if your pattern is once a week vomiting, once a week regurgitation, once a week a little soft stool, I mean, I'm probably not so excited until it's every day that week instead of the normal pattern. So again, I'm resetting the focus as to what is the normal for this critter and how does it get thrown off balance? And then it's a gray scale. You're not going to have a black and white on here. You're going to have to say, I'm just going to pull the trigger today because it's been 3 days in a row of once a day vomiting. They're still wagging their tail. They're still eating, but it's off the pattern, and it's often better to get on top of it a little earlier than later. And do you need to see your emergency veterinarian? Well, if you can get an appointment with your generalist the next day, well, you could probably wait until the next day or the next day after that. But if there's a real striking change, one time vomiting a day, once a week, all of a sudden it's once a day, 3 days in a row. And then the last one, he vomits 2 or 3 times on that last day. Okay, that's completely different. This is now amped up to increasing frequency. It could be increasing severity. And then you're going to say, oh, I just got to get this checked out. Sometimes being safe is better than being sorry. So that's a lot of talking for a short question.
But what I get from that is it sounds like anything that's outside the norm for that animal, it needs to be addressed. Like Karl, you said, so they vomit once a week, okay, but then if it's going to be 2 times a week, 3 times a week, okay, that's abnormal now for that pet. You know what I'm saying? Because they are creatures of habit, sort of, aren't we all?
So does contents matter? For instance, Libby, we have a lot of geese and a lot of ducks that, we have a pond and all that stuff. And she doesn't throw up. And then all of a sudden she throws up and it is like a load of goose poop. So I'm like, you dumbass, you ate all of it. And then, she's fine. She's wagging her tail, barfing her guts out, and she's fine. So I think contents probably matter. Like if you see blood, that to me would scare the crap out of me. I'd be at the vet in about 5 seconds.
It's a good point, Janet, because when I'm talking about this vomit, I'm just talking about like food, undigested food, that foamy stuff. But if it's like blood, if it's a foreign material, if it's a strange creature that they ate, sure. Blood is never something you want to see, whether it's vomit or diarrhea. I would say
on
that
the inside, blood,
true.
I like it on the inside.
Come on the outside, right?
No.
Yeah. And I don't like it on the outside on the white carpet. I'm just going to tell you. Because Wine Away doesn't take that out.
Hydrogen peroxide. Use hydrogen peroxide if it's bloody.
That's right.
My neighbor Carl wanted me to ask you. They're they had family visiting because everybody in Florida has family visiting, and
Wait, is this the one
yellow
with
labs
the yellow
and
lab that are?
Maisie.
Oh, you got to be
Maisie ate a
kidding me
box of
again!
raisins. So at 6 in the morning,
No, 3 or 4
four
of the
little
little
ones.
ones
So
out of the
he
kid's backpack.
came
I was
running
there.
down for the hydrogen peroxide. But when he was sitting at the emergency clinic with his dog to be seen, he started talking to the person next to them, and their dog ate gunpowder. I know. That's what I said.
What's
I said, I'm
gunpowder
going to ask
made
my friend
out of?
Dr. Jandrey how often he sees that.
But wait, what's gunpowder made out of?
Well,
If it's
you
not
can-
lit,
you
it's
can
not
make
gonna.
your own bullets or do something like that.
Yeah,
But
yeah,
you need
yeah.
gunpowder.
I'm just saying. What I wonder if
Remember,
that would
this
hurt
is
them.
Florida.
I have never dealt with the gunpowder ingestion.
Okay, I will tell him.
So I would have to do some looking. I wouldn't plead ignorance. I would suggest that, wow, this is interesting. I deal with animals eating weird stuff all the time. But
What's
this
the
one's new
weirdest?
to
Give us
me,
a
and
weird
I'm
one.
going to go look.
Yeah.
Yeah, give us a weird. What's the
thing that they-
weirdest?
Besides underwear and stuff like that. We know that.
Yeah, I mean, there's so many great things that animals eat.
Oh, God.
I love them to death, but I know that they're gonna do it again. So I guess one of my favorites was, of course, it's the Thanksgiving when I'm the only vet working a 24-hour shift. This is very early in my career, and happy-go-lucky. Of course, it's a golden, and the family comes in and they're like, he just ate the butterball turkey mesh that was, you know how you buy the turkey
Oh, the
and it's got like this plastic mesh thing?
Yeah, and that thing's hard as a rock. It's hard to get off the
Dog
turkey.
ate the entire mesh over this like 20-pound butterball turkey because it, had turkey juice before it was cooked. It was like turkey skin and whatever. I mean, it probably tasted great to the dog, but it ate the whole thing. And I tried to make it vomit with my chemicals and didn't vomit. So yeah, I had to do a surgery to cut it out of its
Oh, you
stomach.
did?
Yeah,
Was it all
still in the
clumped
stomach
up in
or
there?
did it pass into the intestine?
it was starting to pass. So that's why I had to get it out. I had to get it out because it was partly in the stomach, partly in the small intestine. And
Yeah.
for those who don't know, you don't want anything spanning that muscle valve that contracts and opens. That's a bad sign because the rest of the it gets stuck in the stomach, and the rest of the intestines kind of do this accordion up that linear foreign body, and then the mesh and or string starts sawing away at the inside of the intestine. Sooner or later, it saws through the intestine, and then the intestinal contents leak into the abdomen cavity. And we call that a septic peritonitis because it's a huge infection in the belly. And they go from sick to critically ill, nearly dead, pretty quick. So sometimes dealing with these repeat offenders that love to eat things.
What
are
about
a problem.
cats, Carl? What about cats with the string around the tongue? Do you still see that?
Yeah, on occasion, whenever we get a cat that's vomiting, it's essential that we have to look under their tongue.
Janet, did you ever hear about that?
There's no way I
Okay,
could
well,
get
Carl,
into
tell
these
her what
cats'
happens, 'cause I
mouths
know
to
Janet
look
has
for
no
a
clue
string.
about this.
So that it goes. Why do they? Oh, because they play with it and they eat it.
String off of packages, ribbons, tinsel from Christmas trees.
Thread.
They're long. They're longer than a cat. So they go down, but sometimes they get looped around the base of their tongue and it's stuck. So it goes all the way down through the esophagus, through the stomach, into the intestine. And again, it starts this accordioning where it's going to start sawing through the inside lining of their gastrointestinal tract. It's super bad. So every cat, despite them being mean or not, we have to look under their tongues. So sometimes we have to just sedate them to make sure that our exam is full and complete. And while they're sedated, we probably take an x-ray. And sometimes these can come out with endoscopy. So it's a fiber optic camera on the end of a scope that's flexible, and it could go down the intestinal tract, just like people have endoscopies or colonoscopies. We use the same kind of video cameras on big, long, flexible tubing that allows us under anesthesia to find these foreign materials. And sometimes we can pull them out without surgery.
Do you?
I bet those cats don't have to do the colonoscopy
Right,
prep
I know.
like the humans.
But Carl, do you cut, like, where if it's wrapped around the base of the tongue, do you trim that and then let the string go all the way through, or pull it out, or you see what I'm saying?
Usually we don't pull it out. Usually we
You
cut
let it
it.
go through.
I mean, if we can cut it and pull it gently and
Yeah.
we're in luck, if it all comes out smoothly without any tension or resistance, I'll pull it. But if it has any resistance or tension, I think it's stuck on something else down below.
Yeah.
And then that's going to have to be a surgery or a scope. I mean,
Janet,
Janet,
that's
you should
common.
come to the emergency room. You should come work with me for a day and just see what is going on. You would
Because, you know, I could do all the sound effects, Dr. Karl. I'd be like, oh my
Janet,
God.
cats
I'm really
will
good.
actually eat a threaded needle.
sure.
With the needle in there?
Oh, and fish hooks.
Oh. Okay, wait. I looked up gunpowder. And you know what? Now they're going to think I'm the Unabomber. Sulfur, charcoal, and potassium nitrate, which is called saltpeter.
Okay.
I,
So is that
I
deadly?
still have no idea.
Not if it doesn't boom.
Okay,
Honestly,
so
I still
Karl,
have to look it up.
our next question is, I'm driving in a car and the car in front of me hits a dog. And they keep going, but I'm the caring person and stop.
Because they didn't notice they hit
Yeah,
the
they
dog.
were
I
on their
bet.
phone.
What do we do?
Or cat.
Well, first and foremost, don't drive while texting.
Yes.
That's my
Thank you.
public service announcement. I'm not a veterinarian right now. I'm just a
Thank you. I'm
member of
with
the
you there.
community.
For sure.
But if you happen to do the unfortunate thing and hit an animal while driving, I mean, we're in Davis, California. We're the biking capital of the states.
Yes.
People hit animals on the bikes, so we get hit by bikes, we get hit by cars. When I worked in Philadelphia, we got hit by SEPTA, so the light rail train system. So we've had all sorts of hit bys, trucks. Sometimes the animals fall out of the back of a truck too because they're not cross-tied.
Oh,
So we've had there's lots of trauma. So back to your question, Alice, I would suggest that first and foremost, you have to realize that this animal is anywhere from normal and unscathed to dead
yeah.
and anywhere in between. So if they're unscathed, they're going to walk around, they're going to run from you. They might come up and find you to be a soul that's going to comfort them. But they could also be aggressive, and they
Yes.
might want to kill you because they think you just did what that.
And they're scared.
And they're scared.
Of course. So first and foremost, don't get bitten.
Yeah.
And if you're in your car, hopefully you have some supplies that you might be able to pull
And
that might help
we
you
need to
to
talk
restrain.
about that after this. Yes.
Yeah. So I mean, I would have like a blanket to cover an animal, a leash just in case to put a slip lead around the dog's neck. A blanket would help to cover a cat that's freaking out or halfway up a tree, and then you can try to corral it. I doubt you're going to carry muzzles and things along those lines, but another slip lead, another leash, you can put it around their muzzle, cross it under their neck, and tie it behind their back. That could be a way to prevent them from biting you. I mean, you want to do good things, but you shouldn't put yourself at risk. So,
Yes.
Because then you're going to have to get a rabies shot at some point.
yeah, I mean, Alice and I are already vaccinated as veterinarians because this is our line of work and our titers are good. But if you've never been vaccinated, I don't want you getting bitten because next thing you know, you're going to the hospital. And then who's taking the animal to the nearest hospital? You know, a thing about being prepared also is know where your emergency clinics are. If you're a member of
Especially if
this
you're
neighborhood in this
traveling.
community.
Yes.
Yeah, if you're traveling, say you took a car ride and you're halfway
Yep.
between Ohio and Florida, and this
Right.
happens in North Carolina on
Yeah.
I-95, you're going to have to start Googling the nearest vet hospital that's open. But knowing where to go is certainly helpful because you're going to try to restrain the animal, corral the animal, and get that animal
Mm-hmm.
safer than in the road.
Right.
And then, I mean, there's not a lot you're going to be able to do potentially for the most critically ill. You just need to scoop and run as fast as possible. If the animal is not so bad and you can have an ID tag on it, then you might be able to find a phone number to call the owner, and you can just confine the animal, keep them as calm as possible, just assess the situation. If they're moving, if they are walking on 3 legs instead of 4, you make a phone call to the people and say, it looks like he's injured X leg, or he's walking around fine. He's just scared out of his wits. I don't know where you live, but I'm here at the corner of X and Y. Come and get your critter. I mean, that's the kind of simple stuff, but it requires to have, like I said, maybe a couple blankets or towels, a couple slip leads, leashes, and muzzle maybe, but that's also hard to stock in your car.
You know, Alice told me once, because I always have like a couple beach towels because of the dog. But you also said, Alice, once I have beach towel, cover up their face. And then the other thing you can tie a muzzle with is a sock. For some reason, that's stuck in my
that's a
head.
long sock,
So you could
yeah.
use that. But, you know, speaking of scoop and run, let's talk about the Ohio State Buckeyes and Sawyer with the scoop and run for the 83-yard touchdown. Just saying. Had to bring that up, scoop and run.
I just have to, for a full disclosure, both Alice and I are graduates from the Ohio State University College of Veterinary Medicine. And I today thought I should wear scarlet and gray just to celebrate my Buckeyes. Because I knew you secretly, Janet and Alice, would have appreciated my little shout out to the Buckeyes. But I'm not employed by the university. I'm employed by UC Davis, so I thought I'd wear. I have a lot, unfortunately, not unfortunately, I have a lot more UC Davis clothes than I do Ohio State vet med
We
clothes.
let Rusty.
Yeah, they pay your salary,
we let Dr.
Carl.
Rusty Moore wear all his Buckeye paraphernalia when he's on. So
Well, I actually got the question because we have the Ohio State flag and I have this whole display in the family room. And I finally got the question from my husband. So I know they won. Like, when is it coming down?
that's true.
So actually, last week we switched back to the American flag.
Okay,
so,
well,
there you go.
I did put out my Ohio State flag on my front of my house,
Yay.
and it's not coming down.
Yay.
Oh, yay! There are actually a couple in town I drive by and I kind of go, oh, H, when I drive by. They never hear me. But
There are none in Davis, California. It's just me.
Oh, that's true. The other thing I want to add to the emergency first aid kit that you carry in the car, I carry a small cardboard box in case I find, like I found those baby possum, Janet, that were crawling out of the hit possum mommy, and also birds. Because, you know, people immediately find an injured bird and they want to feed it. You need to put it in the box, keep it in somewhere warm, dark, leave it alone for a while, because sometimes they're just shocky.
But
anything to add to that, Carl?
I agree with that, Alice. A box is not a bad idea because there are a lot of little creatures that people stumble upon. I mean, you go to a gas station and there'll be little kittens hanging out over the curb. You go on a hike and next thing you know, a bird fell out of a tree. And sometimes the nature needs to be nature and their parents might be looking like they fell out of a tree, but they've done this before. And sometimes if you scoop and run with the fledgling, you may have just disrupted their abilities to be good parents and that fledgling to have learned. So sometimes you have to use your thought process. I mean, not everyone knows every species' behavior patterns. So I think we have to be thoughtful about, do I grab this critter and do I take it to a vet or a wildlife rehab center, or do I just let it be? I assume that most people have access to their county animal shelters or animal services. If you don't know, it's probably worth to call to them, because sometimes they would say, actually, in this case, thank you for calling us. We recommend, because we understand the behavior. It's the breeding season or it's the flyaway season. It's something, let's just let that one sit there. And that's the best thing for it. But if it's a domesticated species and you have more knowledge, because we're more commonly understanding behavior patterns of dogs, of cats, maybe rabbits or hamsters, guinea pigs. I mean, if you see a fancy guinea pig running around on I-90, that's not normal.
Right.
You probably want to scoop it up, put it in your box. But it's a good idea. And the other thing about the muzzle, use your belt.
Yes, right.
Oh, yeah.
And
Longer.
So we kind of live with woods around us in Connecticut, and it's been the last couple of weeks. It must be deer makeout season or something, because they're all traipsing through. No, and some of the bucks have one of these, some have two, some have one, like this, or two, or one's big. So I think he's like the hot guy. I mean, it's like they all look different coming through the yard, and it's like
November, Janet.
I don't know. Something's going on now. Because they're strutting their stuff, and I think there's something to do with those size of those antler things.
There is.
I've got a question for Carl, because I've had some friends of mine. This happened to two of their older dogs, where they wake up one morning and they can't stand up. It's like their balance is off. Would you address that, Carl? And it's usually old dogs.
Sure. And I also want to address seizures. We haven't talked about seizures either.
Yes,
But now we're going into the sort of the neurologic
that's right.
emergencies. We talked about the gastrointestinal ones. I think
Yes.
we're done with vomiting and diarrhea.
And
we
the hit
talked
by
about
car ones.
hit by cars, traumas. I think we went through that. But yeah, neurologic emergencies are pretty
Yes, let's
clear.
talk about
If
that.
your animal's walking along completely normal and now has a head tilt, its eyes are jiggling back and forth fast without thinking about it, like it's just looking at you and its eyes are going like this, and or twisting its body, maybe alligator rolling, and they can't stand up. Maybe they're even vomiting.
What's alligator rolling? Oh my God.
Well, people in Florida know what that is, alligator rolling, right?
They
It's like you
roll.
try to confine an alligator and
You've
it
seen
tries
that,
to get away.
Janet.
It gets away by rolling and turning around.
Oh, it
And
rolls. Like, you mean so dogs do that?
not normally, but if they're doing it, I worry about their balance. They could have this wicked thing called vestibular disease. It's like vertigo in people. And this
Ooh,
would be a problem with either their inner ear, the brain that receives the signals, or a combination of the both of them. And these animals, like Alice said, they tend to be a little older, and these could come out like a ton of bricks. 100% normal, and all of a sudden the animal's twisty head, twisty body, vomiting, and is flopping all over the
frightening.
ground.
Yeah.
It's very scary because you've never seen anything like that before. And 5 seconds ago, your dog was perfectly normal. This is typically a dog thing more than a cat thing. Cats can get it, but I would say it's a little more rare. It's something you should probably check out with a veterinarian. Get your dog comfortable, scoop them up, console them, stop them. And it might take a bit of time because they have no horizon. Their horizon is flipping everywhere, so they don't know what's going on. So you might have to just sort of wrestle them a little bit, hold them tight, hold them close to you. Hopefully they're not going to bite you because they're okay with this. But yeah, that one probably should see a veterinarian. And just like a seizure, if your animal has been normal, and never has had a problem, and then in front of you falls over and starts having very severe muscle spasms. It's almost like they're unconscious to the world. If you call their name, they're not going to respond. They could be chattering their teeth, drooling. They might vomit. They might have defecated. And they're running. They're like running in place, shivering. Their entire body is convulsing. And this is a very short thing. It usually lasts 30 to 60 seconds. And it stops. This would be a classic grand mal seizure.
What should you do when they're doing that? Just leave them alone. You shouldn't try to go up to them, right?
I would stay away from their mouth. One,
Right.
they could bite you, but it's not because they are doing it out of malice. They're just unconscious. They have no idea what they're doing. So I usually stay away from the face, to tell you the truth. I'm a big fan of blankets. I'd cover them with a blanket and try to hold them down if you can. But again, they're so much stronger than you can actually imagine when they're doing this. Every muscle is tight and working and pumped up. They are often much stronger than us. So confining them is difficult, but staying away from injury is important, and trying to maintain their safety. Because there's been some animals that seizure into the pool.
Oh.
You know, they're going to drown because they're unaware of what's
Yeah.
going on.
Or fall
30
down the
seconds in a
steps.
pool.
Yeah.
Or falling down the stairs, that kind of stuff. Protecting from, like, if they're on the couch and they do this, protect them from falling off the couch because the injury could be worsened when they hit the ground. So those are the kind of things with seizures. And if it's never happened before, you might want to see a veterinarian. If your animal has had a consistent history of seizures, again, what's the normal pattern of my dog or my cat? If it's been diagnosed as an epileptic when it was 2 or 3 years old and it has one seizure every 3 months, okay, you'll be like, oh, I've seen this before.
Yeah.
This one looks like every other seizure. I'm just going to watch it. I'm going to record it in my calendar and I'm going to be done with it because I hope it's just like every other seizure. And then you wait and you go on your merry way and act as if nothing's happened, but you record it. So in that case, if your animal has increasing seizure frequency, so more than once every 3 months in this case, if each seizure is more severe, like instead of 30 to 60 seconds, they're now lasting 3 to 5 minutes. And or if they come in clusters, normally that animal for this instance was once every 3 months, but now if it has 4 seizures in one single day, that would be a cluster. So increasing severity, increasing frequency, or clustering. Those definitely need to be seen because that's different than a normal pattern for this dog. And every animal seizure disorder is going to have a different pattern.
At what point does the dog need to go on anti-seizure meds?
Great question. So some people and some neurologists, after doing a full workup and determining that it's epilepsy, if the animal has seizure frequency, maybe once every 3 months or more frequently, they might start medicating it.
Oh, okay.
The reason is the goals typically are to increase this distance between the seizure by 2. So if we're seizuring once every 3 months and we want to slow that down, our goal is to give a medication to go no more frequently than once every 6 months. I would say that's probably a successful long-term therapy. If we have an animal that seizures once a year, it's probably not worth putting them on drugs for an entire year to prevent a seizure every year to go to one seizure every 2 years. So everyone's having a little different threshold again for what they could tolerate in a seizuring animal. I'm talking about an epileptic type animal. This is one that has no known cause for the seizures. It's probably just a little glitch in the talking of their nerves, but not like a structural problem like an infection or a cancerous process or an inflammatory condition. So it depends on how frequent. If you want to see your dog seizure once a month and it doesn't do him any problems, you might not want to medicate him because the dog doesn't care and you don't care. Yeah. But some people are like, oh my God, I just don't want to see that often. Have a discussion with your veterinarian, whether they're a general practitioner, an emergency practitioner, or a neurology specialist. They can all give you guidance.
Now this is going to sound strange, but I want to talk about the rectal area because nobody looks at that area. No pet owners look at the butt. And yet I'm sure, I know when I manned the phones as a senior vet student, we got a lot of questions about scooting and what's that smell back there, and my dog's having blood from his rectum.
It's no fun till we talk butts. I like big butts and I cannot lie.
Well, believe it or not, I mean, in dermatology, we would see a lot of problems back there. And sometimes it was nothing, but to me, if it's something to the owner, it's something. Even though Karl and me as vets would say, oh, the anal glands were full and we just emptied them, blah, blah, blah. But sometimes you get a ruptured anal gland, and that has to be painful for the dog, and blood is coming out. And so, Karl, would you address why pet owners should kind of look back there occasionally?
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. AtopiCream HC by Vetrimax is a unique anti-inflammatory, rehydrating, leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. AtopiCream HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetrimax products. Vetrimax makes it better.
Blood coming out of anything is not good.
Or swelling are not good.
Okay, and don't put this in, producers, but my friend Ann was a paramedic, and she brought in somebody, a human, with a light bulb up there.
Oh my God.
What the? No, but first of all, just think about the shatter aspect of that.
LED
Anyway,
or
how do you explain that one?
Please edit that out.
They will edit that out, but oh my God. Yeah.
But anyway,
Alice, it's funny that you bring up butts because I would consider, let's just say I agree with you as a veterinarian that I think not only do animal owners not pay enough attention to the south end, but veterinarians don't often do a rectal exam as
I
part of their
agree.
complete physical. And I would suggest that if we have not done a rectal
Really?
exam on a dog, I mean, there's a rare cat that's going to allow you to do that. So I'm giving cats a pass
Not mine.
here because if I'm going to do
I
a rectal
still
on a
look
cat,
back
they're going
there,
to be
though. Yeah.
they're going to be sedated. I will look. There's a lot of fun stuff that goes on in cats' south parts.
Yeah.
You know, I love our clients. They're so cute. They're like, something's going on down there.
I
They
know.
have different euphemisms for
We're
And they're
looking at the bottom of the
private.
feet down there. No, the other down there.
yeah. So I have to be that guy. I'm like, are you meaning the anus? Are you meaning the vulva? Are you meaning the prepuce?
Yeah.
Are you the scrotum? I have to be that guy. But
20 words, right?
I mean, I have to do what's best for the animal,
Right.
and I need to know
Right.
these things, and I can't sugarcoat anything because I want the best for their animal,
Right.
and I hope that people are not offended by us using words, but I understand
No.
their worries when they talk about down there, and maybe it's not culturally appropriate. So I have to dial it back to science. And yes, Alice, there are a lot of bad things that go on down there. So yes, anal sac problems, scooting.
Cancer's
see-
back there.
We see perirectal tumors.
Yeah.
We see
Oh my
perineal
gosh.
hernias and perianal hernias. Like those old German Shepherd guys that have just a immune disease where their tissues around their butt just start disintegrating unless we get on
Yeah.
top of it with
Horrible.
like severely immunosuppressant drugs. Rectal or perirectal abscesses, like from an anal gland. We see, cats are often licking down there when they have signs of penile disease, perputial disease, urethral disease, or cystic disease, meaning their urinary bladder. They could have urinary obstruction. They can have urethritis. They can have preputial disease. They could have vaginitis if they're young puppies. So there's a lot of attention that the dog is going to be drawing to, and the owner's going to have to pay attention and be like, why are you licking your butt so much? And then when you look under the tail, or if it's like, God love them, but cattle dogs, Australian Shepherds, they're so hairy back there. Sometimes you don't see anything.
Golden
Yeah.
retrievers.
It's months. It's months and months of development where
Yeah.
all of a sudden we shave off the hair, and next thing you know, we're like, whoa, this horse is way out of the barn on that one. It's been going on for weeks or months because, the animal's just trucking along like, oh, I just lick it every so often to make it feel better, and I'm just going to tolerate it. But it's until we do some stuff where we're like, wow, this is actually really hot, and we need to help this little critter out. So there's a
sometimes,
lot of
Jan-
stuff that goes on back there.
Yeah, like in the little furry dogs like a Lhasa or Shih Tzu, sometimes the
Yeah.
hair is so caked back there that they can't poop. The poop doesn't come out. And
Oh
they
my
get
God.
sick from that. Or like Carl said, you shave and there's a little surprise of maggots back there. Like in collies, long-haired dogs, especially in summer, like in August, I always tell people, or when Carl and I were examining our animals, we always look back there because there can be surprises. I know it's a private area, but it's your pet.
Right. And it's not
No.
private to the pet.
Right.
Do you know what I'm saying? It's more of a
Yeah,
human
and they
thing.
don't care. They
Yeah, they
appreciate
don't
you
care.
paid attention. Yeah. So thanks
Yeah.
to all our wonderful groomers who are tuning in, and thanks for the hard work that you do. Because
Yes.
Yeah.
they do amazing things with these animals who don't want them to do things to them, like shaving their butt ends
Yeah.
because it's important, shaving between their toes so they don't get plant-ons and foxtails stuck in there, which can cause
Yeah.
infections in between their toes. For doing the ear trims and plucking the hair in there because that's another source of ear infections and a source of foxtails. We see so many foxtails in California.
Mhm.
They just get on the hair right on the tip. Next thing you know, with a hairy ear, it just finds its way inside, ruptures the eardrum, and next thing you know, Dr. Jerome has to go in there with a video scope and clean everything out, and it's a mess. So thanks to the groomers for doing all these nice
You're right. They're
upkeeps-
thorough.
Yes.
upkeeps of the. They
Yeah.
do a lot of prevention. So
Carl,
kudos.
do
to them.
you have
They do.
porcupines in California like they do here in eastern Ohio and Pennsylvania?
Yeah, we have some porcupines. They're not super common, and they're not common right by us in Davis,
Oh,
but
good.
they're around.
Because
I
we
dealt
would
with
get a few of
porcupines in
those
Sonoma
every
County.
year too. Yeah.
But he's got rattlesnakes out there. We had tarantulas when I lived there. I used to see them on my walks. It's really creepy.
Love the rattlesnakes.
Oh.
Do you?
Well, I mean, I think
No.
they're super cool. They're just
Oh, they're super cool. But I used to go out to my hose box and I'd be like, bam, 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 bam with my
Yeah.
foot because you never knew it was coming out
correct.
of there.
You have to
Oh, yeah.
rattle. You have to rattle whatever you're going for in the summer. You're going to get a tool out of the tool shed. You got to rattle the door and scare all the black widows away and all the rattlesnakes out.
Oh my gosh.
And you never put your
And what's
boots
the
on.
bad
If your
spider? The brown,
if your boots are on, you
the brown recluse.
oh yeah, those aren't such a big deal. They're overrated.
But you get bit and you like swell up.
Yeah, our dogs aren't.
Okay, I do have a prop.
Okay. Good job. That is cool.
Okay. Allison, see, it goes like this. So whenever we have a little cat vomit, we put it out.
Well, in my house, I clean it up.
Yeah, right.
We do too. But it's so funny because after you've had cats for a long time, you're just like, hey, there's cat vomit in the family room. Okay, I'll
Are
get it
those
at
two
some
cats
point.
you adopted, Carl, vomiting now?
No, my cats don't vomit.
Okay, good. Do they like
Luckily.
the fish tank?
Mine do.
However, they did decide to eat chunks of the plastic Christmas tree. So we did had some. I think we had 2 episodes of vomiting green plastic Christmas tree schmoo.
The bristles,
Yeah.
looks like a
Wow.
Yeah.
really.
Yeah.
This was the first year we had a fake tree, and they didn't go near
really?
it.
Yeah.
Yeah. Usually they'd go under it and like sleep under it, like they were in the wilderness. But the fake one,
Oh,
they
I
didn't go
Yeah, I
near
don't
it.
put
Ask
tinsel
you.
on my tree.
Oh.
I
No, I
want
don't
it.
either.
And I usually don't. I try to make sure there's no ribbons or strings or anything like that around the holidays. Because I don't know. My cats are now just a little over a year with me, and I got them as adults. So I can't trust them for anything, and I don't
Yeah.
want to have to do the things that I have to do, like X-rays and surgery. And I mean, they're in surge. Don't get me wrong. I
Right.
can afford all the things they need, but just don't want to go there. Prevention.
Non-trustworthy cat.
Prevention.
what did-
That's the most important. I'm an emergency critical
What-
care specialist, but it'd be so much better if I was a preventionist.
Right.
I can just
Right.
maybe I should do it. Maybe I should form a business. I can go into people's houses and coach them on how to animal proof things. I mean, maybe
Yes.
Like baby
children.
proofing. Like baby proofing.
Are there baby proofers?
Oh my God. Yes, it was a huge business down in where I lived in Menlo Park. It was like huge. They'd come in and put those things on
And
your
the
drawers
plugs,
and the
the
knob
outlets,
covers and all
yeah.
this. The plug, like how hard is that to do?
Oh gosh,
Anyway.
I'm gonna make an animal preventionist service when I retire.
Ooh, I
I'd love to
love
do
that.
that. Alex, I can do
No,
that.
wait, Carl, what are the cats' names?
Mango and chutney.
Of course.
Mango and chutney. Aw.
Janet, you don't know this, but Carl surprised me by going into emergency medicine because I thought he was going to go into ophthalmology,
Me too.
which is my next question for him.
Which you almost went
I
into
know, but I don't like
ophthalmology too,
surgery.
you know. And that's when she was doing her internship, whatever. She goes, go look in the refrigerator. And I open it up and there's like cow
Okay.
eyeballs
She tells
in
the
there.
story
It's
all
just
the
not my world, Carl.
I
Not
think
my
we
world.
have to
I
edit
know,
that
not my
out.
world.
Yes.
Too.
But I want to ask Carl what owners need to look for because eyes can, as we say, go south in 24 hours.
Fast.
Well, sure.
So
I
what
mean-
are some things like if the cat's rubbing its eye, or my golden that just came here, if I notice one of her eyes is red and she's doing this,
Yeah.
take it from there.
Oh.
So, I mean, luckily we have 2 eyes because there's always one to compare with. We hope. If one is off, then the other one hopefully is the normal one. You can be like, that one doesn't look like that one. So
Right.
squinting, extra fluid, tearing coming out of the eye onto the face, blinking, squinting, we call blepharospasm, if the eye's shut. If it's really swollen in appearance, the eye or the eyelids. So again, asymmetry. One side looks normal, one side looks really bizarro. You don't want to wait at all. Sometimes you might say the cornea on here, it's a nice crystal clear cornea. You can see my iris. This one, what if it's all white and milky? You don't see it looks like there's
Yeah.
a cloud on the
Yeah.
surface. That would be a problem because again, it doesn't look like the other one.
Oh.
So discoloration, pain, fluid. Did I say swelling? So those are probably the
Yeah.
big four. Um,
It's a big change.
and
And
you know,
what if the white
sometimes
of the eye is
painful
red?
eating. Say that again.
Painful what?
Oh, one other thing I was going to say is sometimes painful eating. Sometimes they might have this swollen eye and it'd be hard to chew because the back of the eye hits the back of the mouth. And as they crunch down,
Oh.
it causes pressure here. So sometimes this is manifested as oral pain. So
Wow.
that's harder one to see, but usually that's with the big swollen eye. Sorry, Alice, I missed your question.
Oh, no,
Oh.
I was going to say,
Yeah, you
what
said
if the
something.
white of the eye is red?
Oh, yeah. Yeah, for sure, redness. It could be just a little irritation, which is still something you should get on top of, but it could indicate a scratch. It could indicate that it was poked. It could have been, I mean, if it's a dog who is like a pug or a French
Yeah.
bulldog whose eyeballs are basically out in front of their face like a
Yeah.
bumper instead of their nose. Sometimes the eye hits something first before their nose does. They might have gotten a puncture or a cat ran by and slashed them with their cornea. Slash them with their claw onto their cornea. Those all need to be seen fast. If you're going to have something at home for those kind of things, the only thing I think I would have for people to have in their little toolkit, veterinary toolkit, is to have artificial tears, like either artificial tear drops or artificial
Oh.
tear ointments. No drugs, all
Right.
protection. You might just want to slather that on an eye and get to a veterinarian. Take your product with you and say, hey, I saw this weird swelling. I saw this weird redness. I saw this weird cloudiness. I put this on it to protect the eye. So you bring your little bottle in with you or the tube of ointment and just say, this is what I put on it. And they'll be happy and they'll know what you did. I would not use like your own eyeball medicines. If you have special meds for yourself, don't do that because you could use the wrong medicine for the wrong problem and you could be way behind the 8 ball. You may have done more damage. So just a non-drug protecting eye ointment or a non-drug drop, artificial tear drop, that would be something to help the eye just be comforted while you seek veterinary attention.
What if they get sprayed in the
Wow.
face by a skunk? What do I do for the eyes then?
I mean, if they're really irritated, that might just be flush them out with like a contact saline type solution.
Okay.
There are saline solutions that have preservatives in them. Those ones might be somewhat irritating. Some animals are a little irritated
Yeah.
by the like benzalkonium chloride preservative. But if it's a simple eye wash solution, just a saline solution, that might be the best thing to do. Often when they're sprayed in the face, they tear up a lot, and the tearing is naturally bathing the gunk out of their eye. If you can get over the smell of a skunked animal, you can flush their eyes out with saline. But again, you might just want to seek veterinary attention. Everything today, it sounds like everything I say today is go seek a veterinarian's advice. But we're talking about a lot of stuff. I'm
Yeah.
not just trying to drum up business.
Sure.
I'm not drumming up business. I'm
No,
trying to
No,
prevent
no.
business. I really think that so many things really need a knowledgeable person. And I don't
Yep.
know if Dr. Google is good enough to fine tune the recommendations.
Yes.
I'm all about seeking consultations by beautiful podcasts like this to learn things, or looking on another podcast or some one pagers that might be on the internet about what to do in case my animal has whatever, licking their butt or scooting or has bloody tears or something like that. Still, the veterinarian is going to be your best source of information. And don't hesitate to go when you don't know.
What about this thing that
Yeah, I
people
agree.
get very nervous about, this reverse sneeze that we call?
Oh,
Yeah, what is that?
well, I mean, I guess the honest answer is no one really knows. I think the last stuff I read said there might be a source of allergens, and this might be an allergenic response to something that's floating around their environment. One paper, I think it was eons ago, Allison can remind me, I thought it was a trial of diphenhydramine or Benadryl may have reduced the symptoms of patients that may have had allergenic-induced reverse sneezing. But this reverse sneezing is just kind of an irritant response.
Yeah.
It's something you don't need to seek veterinary attention for. First thing of the day, we don't need to see a vet for. Yeah, I mean, you've seen it before.
What is it in dogs or cats? Dogs, right?
Dogs. Yeah, they
Dogs.
You know, Carl, I remember
Yeah.
when I was
Like a snort.
Like a
laying in
snort.
bed studying, and I was just about to go to sleep, and I thought, it was a chapter in a book, and I looked to see how many pages were left, and I saw the last page had a paragraph about this big, about 4 sentences about reverse sneeze, and I thought, oh my gosh, I'm finally going to find out what this reverse sneeze is all about. And then the very last sentence is, we don't know what causes it. It was such a letdown.
I mean, veterinarians know things, but we still do not know everything. I mean, same with physicians and same
Yeah.
with all sorts of medical professionals. This is we're learning all the time. The explosion of information is huge.
Right.
But I guess reverse sneezing hasn't made it to the level of let's study this.
No,
There's
and that's
no-
what's kind of sad. It's kind of in the company of sebaceous adenomas, quote unquote warts. It's the thing that's always out there, and nobody's ever really studied it. You know,
Because it's not really killing anyone, right?
but it's a concern. See, that's the thing. It's a concern for people. And it keeps happening, like in poodles and Cocker Spaniels, they get all these little, people call them warts, but they're actually overgrowths of these oil glands, sebaceous glands. And we
Oh.
don't know how to prevent them. The only way to get rid of them is surgical, and they're like 14-year-old dogs. I mean, you don't want to put them under for a benign
No.
skin problem. So I just wish sometimes we would focus on more common things. You know what I'm saying? Getting to the root, like the common cold. We still don't know that either.
We still don't know. Or the flu. Hello.
Yeah. I think that sometimes we should just live with our warty little critters and be thankful that they don't have bloody diarrhea all over our house.
Or vomit.
On the white carpet. So, Carl, what are you most passionate about in your profession in the work that you do?
Oh my gosh, Janet, you are so cute. That's a great question.
I know, Alice doesn't believe me, but I say that all the time. Because I'm the little sister, I get the crap beat out of me.
Oh, I'm the little brother. Totally
That's
know that.
right, you are.
You get it. But you know what, Carl? We got away with murder because we watched the two older idiots get in trouble.
I
It was
never
so
got
easy.
Yeah, I was the third.
Yeah, 'cause
I
you
was
were-
the
I learned
third,
it.
and they blazed trails that I didn't have to.
See, the farther along the
too.
line, you learn not to tell your mother anything. Because the firstborn tells them everything, and you're like, what are you, stupid? What are you telling her that for?
Stupid. But you could tell
Oh,
Daddy stuff.
Easy.
Easy. He was like so even keel and calm.
Carl,
And my
how's your
mom was
cat?
like,
every time I go by the house there, when I'm
He's
there,
good.
I think of
He's
him.
good.
Oh,
I talked
good.
to him yesterday because I had a question about a car windshield. I'm like, Dad, what's up with this car windshield thing? So he's a antique car guy. So
Yeah.
I called him with a question. He was like, well, here's what I know about that. Yeah, he's good.
Yeah, good.
what kind of car is
Oh,
it?
my dad likes pre-war Studebakers.
Oh.
So he's like between
Whoa.
35 and 42, 41, 42 is kind of the oldest ones he'll
I
have,
didn't
but he
know
likes
that.
to
Hmm.
dabble in restoring. Like he's got some amazingly beautiful cars.
Mm.
Are there a lot of those around?
No,
They must be
it's
rare.
a small group, but they're worldwide and they all know each other.
Yeah, they all know each other.
Oh, that's so cute. That's
It's
so
just like
cute.
veterinary medicine.
Wow.
It's like,
Right.
Yeah.
it's
It
only
is.
two degrees of separation.
Yeah.
So we're wasting time. I gotta get back to Janet's question.
Okay.
So I'm just a guy who loves what I do. Like I'm
It shows.
I'm so
I can
I'm
tell.
so blessed to
can
be
tell.
able to do something I love, to be able to help people and their animals, to be able to help my scholars to advance to their level that they want to get to. I am so lucky. Even to get to do clinical research. Sorry, Alice, not on sebaceous adenomas, not on reverse sneezing. I like blood. If you want to have a whole episode about blood, bleeding, and clotting,
Okay.
I'm your guy.
Okay.
But what am I passionate about? I'm passionate about the fact that I get to do amazing things with amazing people. And I
That's so
never,
cool.
ever have been bored. I never have ever felt like fatigued. I mean, yes, I get
Yeah.
tired, but it's more energizing than
That's
debilitating. Yeah, I
And I love where
graduated
you
in
live.
90.
It's not work.
I'm after,
It's not
what's it,
work.
32 years of being a vet, and I still feel like I just
Wow.
graduated. It's fascinating. It's
Yeah.
all cool. The more people I know, the more amazing I got. I saw a faculty seminar today on orthopedics, and I was like, when's the last time I touched a bone to do like an orthopedic surgery? I think it was
Yeah.
vet school. I really have no interest in surgery of bones. I know how to do orthopedic exams. I know how to fix and stabilize fractures, radiographs, all this stuff. But then I send them to the surgeons. I was captivated by this presentation. It was so interesting, so much detail, and so many advances that they were reporting
I bet.
over this 10-year career of this veterinarian who's applying for a job. And I hope we get to hire him because he's amazing. I was floored how good it was. And I'm like, I don't care at all about orthopedics, but this
Yeah.
was so cool.
It
Like
was
maybe
cool.
it's just I'm just passionate about being curious.
Well, I think you
I'm
love
still
learning.
curious.
I think that's the secret.
Yeah.
I think the moment you don't want to learn, you might as well, But learning is so cool because there's so much to learn, and especially, well, not just in veterinary medicine, but I agree with you, Karl. I was listening to a neurology podcast the other day, and I actually listened to it twice. It was so good.
Good.
Yeah.
Yep.
So, Carl, do you know Katie Morgan? She's a student.
Yes, I do. She's from Connecticut.
I know because her aunt and uncle live 2 doors down from me, and I'm friends with them and her mom and her
Oh,
dad.
that's so funny. You live on
We
the
love
same-
Katie. I just saw her at Christmas, and I said, "Oh my God, we had somebody on from Davis." And I said, "But he'll be back on." It was
Tell her to
so
listen to
funny.
the
She's
podcast
adorable.
And like us.
And
Oh, I gave her a
Okay.
card.
No, I'm telling Carl.
so yeah,
don't
Katie
punk her.
was Katie was on Emergency with me a few months ago, and I wrote her a letter for her internship. And yeah, she's a winner. And I can't believe you live on the same street. It's Darien.
Is her aunt and uncle. And well, it gets better is that her brother literally is goes on archaeological digs. And he's at Harvard, and he's the same age as my older son. And I saw him at Christmas, and he's engaged. And I said, "So what does your fiance do?" And it was like blah 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 blah. And I went, "I have no idea what that means." Like they are definitely two peas in a pod, but he's a fascinating kid. He's traveled all over the world, and so they're a really neat family. Really neat. They have 3 kids, and they've always had dogs. They have retrievers, Labrador
And
retrievers.
Katie's going to be graduating in middle of May, end of May. So yeah,
That's
we're very
right.
excited
Right.
for our
She's
next
That's
step.
such a small world,
Yeah, for
right?
I
sure.
love graduation. I love it. It's like your children are leaving,
I mean, it's
sad,
amazing
but
to be able to
fabulous.
see them as the Associate Dean of Admissions and Student Programs. I can see them through the pathway programs as they're making their application. And then I can welcome them into our school. And I can watch them grow for 4
I love
years.
it.
And it's really powerful to see
Yeah.
someone come in. Average age of entry is about 23 for our scholars.
Yeah.
They finished about
Interesting.
27. So that growth in that 4-year time frame, they go from young men and women with passion and curiosity to being like professionals. Like, I am super proud of them. How cool is that? In 4 years, I can help mold with the other faculty members here, with our staff members of technicians and all the other clerical folks. You turn these people into people you are so proud of. And it makes me feel great about the veterinary profession. And that's when I say, go see a veterinarian for all your stuff. I don't say, go see only this veterinarian.
Right.
You see any of these veterinarians because they
Yeah.
all got the chops, and they're going to be the ones that are going to help you out, whether it's a cow, a dog, an ostrich, a herd of otters floating in the sea in your oceanside town. They do it all. Veterinarians do it all. It's pretty cool. So, passion, Janet, as you asked, what are you passionate about? I'm passionate about what I do, and I'm proud of the people I do it with.
Carl, I'll never forget at our graduation in, not the big one in the stadium, but our vet school graduation in Mershon. It was in Mershon at that
Yep.
time, Mershon Hall.
Yes.
And Dr. Bednarski was the one the anesthesiologist was the one that announced our names, and we picked up the diploma. And at the very end, after we were all seated, everyone got their diploma, he stood there and said, "Ladies and gentlemen, our pride and joy." And everyone stood up, all the parents, all the spouses, all the partners that supported us stood up and just applauded. And I looked, because we're sitting next to each other, classmates, we just didn't know what to say or do. It was such a moment that I'll never forget. Yeah.
Yep, and I'm the guy who gets to do that here at Davis.
Every year, you lucky devil.
Do you get to do the tassel?
I do. I read everybody's name.
That's so
I
cool.
have them move the tassel. I introduce them to the world. Yeah, it's really powerful. Sometimes I choke up.
It's like a birthing almost. Seriously.
Sure. Sure. Okay, so wait, Katie's brother is a PhD candidate at the Harvard History Department. Hold on. He does a BA in archaeological studies from Yale, and then he studied for 2 years in archaeological research in Anglo-Saxon, Norse, and Celtic. So you see why I was like,
Okay.
right? Like, what kind of questions do you
I
ask
have
about that? See any hieroglyphics lately?
No, you ask the same question. You dial it back to you say, "Hey, what are you most passionate about right now?"
That's right.
Passionate about.
Come on, Janet. You're probably good at a cocktail party. You probably got good questions
She
to
is
ask
good at a
people.
cocktail party. I'll give you that. She and I
Yeah,
can really work
yeah.
a room at a cocktail party and have.
Oh man. And the funny thing is, Carl, we'll come home from a cocktail party, my husband and I'll be like, "Did you meet John? He's blah, 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 blah." And then Susie, and he's like, "Jesus Christ,
No,
how
they
did you
didn't
get all
meet
this
anybody.
shit
The
out of these
husbands are
people?"
just over there, and Janet and I, like,
They're over there eating the sausage rinnies, and I'm over there like talking to people.
I have to suggest that you're probably the extrovert in the family then.
yes, both of us.
I think we kind of all are, though. Yeah, I think both of us. Penny,
Oh,
too,
yeah.
our older sister. She's a little more
People love
quiet.
her because when they meet Penny, she just wants to know everything about them, and people love to talk about themselves.
Zeroes in.
She's
Yeah.
a good listener. She asks good questions, and then where did your daughter go to school? And it's all that stuff.
So she's
What are
the
you
introvert who
reading?
wants to talk to one person in detail and in depth
Yeah.
versus, extroverts in general, yours truly included, is okay with superficial meeting everybody.
Yeah.
Yeah.
But superficial is not
Yeah.
necessarily meaning we're not caring. It's
Right.
meaning, okay, knowing
Right.
about 3 or 5 facts. We don't need to know 6 years of history.
Well, so many
No.
people, so little
I need to
time.
work the whole
See,
room.
That's just it.
Yeah.
Yeah.
Yeah, you should see Alice and I. We've done these appearances at these dog events. Oh my God. Like
What?
they're asking me, well, because it says ask the vet. And they start asking me. I'm like, no, hold on.
Yeah, but listen,
Gotta get the
it
doctor.
morphs into, we've heard from a prosecutor talking about the police that he prosecuted. I mean,
Mm-hmm.
we hear stories that have nothing to do with pets. It starts out about pets, and then it just morphs into, yeah. It's very interesting.
Yep. Animal.
I have learned a lot. I got to tell you, I
Me
have learned a
too.
lot.
Even though, this is my profession. Like today's episode that launched was American Heartworm Society. And, Carl, you and I know about heartworm, but it's nice refresher.
Well, look what I learned. I wasn't putting the tick medicine on the cats because they'd run for me. And then I learned that it has the heartworm preventer in it. And I've had these cats 2 years. I think I got it on them twice. So now the 20th of every month, we're like tracking them down, putting it on whether they like it or not. Otherwise, I wasn't doing it because the
gave
one,
you
I think
trouble.
he's here. Oh no, she's eating. Oh, see him lounging right there?
Slacker.
Yes.
But if I go over there, he goes, yeah, he doesn't, we don't get along.
No offense, Janet, but there are people that do that when you're coming.
Yeah, this is true. This is true. Meanwhile, the female cat thinks I'm fabulous. Atticus can't stand me. So
Right.
whatever. I
Listen,
work
we
it.
better wind it up. Carl's
Well,
got to
are
go
we-
back
we-
and do CPR on somebody, so.
No,
I
I'm
know.
off the.
Well, that's a good question for our listeners. You kind
No,
of
I
do
don't
it the
think they
same
should
as
attempt
humans?
that. Carl, what do you
Oh
think?
gosh.
Oh.
Let's just say that my veterinary specialty college is very big in training CPR for sure. to veterinary professionals
Okay.
for sure.
Yeah.
And our next level is first responders. So
Yeah.
Oh.
have our clients save their animals at home with CPR. Yes, I can tell you one particularly, but he was a paramedic and he just adapted what he knew.
Oh, he knew what he was
and he did
yeah.
it for his own Yorkshire Terrier. The dog lived. Was absolutely fabulous. But I would say on an everyday basis, we would need to have some training because it's not a 3-minute or 5-minute thing. It's going to be like theory and practice, and it's probably going to be a 4 to 6 hour thing for you to get really clear about how to do it right and well without doing damage.
Yeah.
So this is
Okay,
the side
good to
effect.
know.
Well, some people would say if the alternative is death,
Yeah.
does it really matter?
Right.
Should I just do something?
Right.
Okay. In that short answer, yes. Pretend it's a small person and do what you were trained by the American Heart Association as best as you can. That's what I would say in a short answer for CPR on dogs and cats.
Yeah.
Okay.
It's adapted differently to other species like fish. They have a very special way you do CPR on a fish. Different things are different. So, but dogs and cats do what you do on a human. Be careful not to break ribs.
Right.
If the alternative is death, I'm not going to say no. The potential win is a win. But I think maybe we would need to create a nice big coast-to-coast campaign to train animal owners on how to do CPR.
Can we back up? How
That'd
do you
be
do
cool.
CPR on a fish?
Well, they're underwater.
Like
You
a
have to
koi.
push them back and forth like this.
You mean you go like a
Because you have to move water through their gills. And hopefully it's
so you
oxygenated
put- you-
water. So you have to push them through water so that you
water,
get the flow
okay.
through their gills. That's what you do for their ventilation,
Okay.
basically. You
Interesting.
can't stick a tube in their airway and breathe
my.
oxygen for them. You have to
Okay.
do that, and it's hard to do that while you're squeezing their little chest at the same time.
Wow.
Let's just say I never had to do it.
Oh.
I'm a dog and cat veterinarian. I rarely have had to be called in. I've done other species, but I'm not really good.
Well, on that note,
Wow.
Janet, I
Well,
think
this
we
has
need to
been
wrap it up.
Yeah, from vomiting
I'm gonna
and
go get my kit
diarrhea
ready for
to
the
fish
car.
CPR. You heard it all here, folks.
To butt skis.
And butts.
There was a little
and butts.
tangent on the south side of the northbound critter.
That's right.
Yes. But we started with vomiting and diarrhea. We ended with fish CPR. I think we covered a lot of ground. I'm proud of you two for
did.
continuing to learn and to continue to spearhead good animal ownership. That's excellent. I appreciate you both. And I look forward to our next
you.
time. What is our next topic?
You better and listen. We got 1 million of them. We'll,
Okay. Have my people.
We'll come up with
Have
something.
my people, or no, have your people call my people.
our people will call your people.
We have producers.
I have no one.
We have producers, and don't forget, we'll have our people call your assistant.
I don't have it.
Just go
My
with it.
assistant's name was Karl
Just go with
Jandrey.
Junior.
Junior.
It's
Right.
what it's what happens after hours when I'm done with my day of 12 hours of working. Then I can help everything else after hours with my assistant, Randy.
So I put these in.
Janet, let's wrap it up. This is Dr. Alice Novotny Jerome,
Okay.
one of the Novotny sisters from Cleveland, Ohio.
Cleveland, Ohio, saying thanks for joining us today. I'm the sister, Janet Novotny King. Thanks for joining us. And Dr. Jandrey, thank you for being on with us from the great state of California. And we'll hear you all next time.
Bye-bye.
You're
Thank
very
you.
welcome. And I wish I was one
Bye.
of the Novotny sisters. I could be Karl Novotny Jandrey from Cleveland, Ohio.
That's right. And Janet, we may have to look into that.
We adopt
too.
people along the way,
Not everybody, though.
Only those
Well,
who are
like
most
Anne,
willing.
Aunt Barbara.
Yes, we're very particular in our adoption process.
As you,
Well, and there's a membership
No,
application.
there is not for Carl.
I mean,
letters
to be
of
in your club,
recommendation.
I'll sign anything to be in your
Me
club.
too.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetrimax Veterinary Supply. Vetrimax makes it better.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.